Hi, my name is Daisy Guzman, and today I'll be presenting my medical mystery case, the pregnancy of life or death. So my case revolves around 18-year-old Abigail Aguilar, who is 3 months pregnant. For weeks, her mother has been claimed she's been acting increasingly bizarre and frightening. She's gone to multiple doctors. Each time the doctor said her symptoms were just a display of her early pregnancy. Abigail was tormented with unremitting nausea, splitting headaches, and severe weakness to the point she had to be carried to her room due to how weak she was. Early pregnancy symptoms. So, during my research, I looked up some early pregnancy symptoms and found some of the symptoms were nausea, vomiting, fatigue, tiredness, food cravings, headaches, and mood changes, some of which match Abigail's symptoms. Possible conditions. I also researched some possible conditions Abigail could have and came across ovarian cancer. Some symptoms, which include nausea, vomiting, fatigue, trouble eating, weight loss, and stomach bloating, which match some symptoms that Abigail was experiencing. I also found symptoms for having a uterine tumor, which include pelvic pain, growing stomach area, fatigue, lower back pain, frequent or trouble urinating, and constipation, some of which also match her symptoms. Discovering the illness. So one day, when Abigail was experiencing a lot of pain, she was transported to the ER and diagnosed with migraine and hyperemesis gravidarum. She was prescribed medicine and lost 10 pounds, and eventually developed severe insomnia. Discovering the illness. Abigail became deeply depressed and was starting to display pregnancy psychosis. She had no prior mental health diagnosis or conditions and was rushed to the mental health clinic when she threatened her mother that she herself would slit her own throat due to the pain she was experiencing. Her mother then rushed her to a mental health clinic, which then Abigail exclaimed that she didn't need mental health help but needed to go to the hospital, which caused her mother to rush her to the Loma Linda Hospital. When she arrived to the hospital, Abigail started acting agitated and psychotic to the health workers, trying to attack some of them. The illness. The doctors conducted an MRI scan and found no abnormalities in Abigail, but they did find an abnormal spine tap, an abnormal enteroencephalogram, an anti-NMDA receptor encephalitis, which disrupts signaling in the brain and is found in 1 in 1.5 million people per year. So this is some of the medical terminology. Hyperemesis gravidarum, which is a pregnancy illness that causes vomiting. Enteroencephalogram, which is the record of brain activity produced by electrons. An anti-NMDA receptor encephalitis, which is the immune system that mistakenly targets neurons in the brain, causing inflammation. Conclusion. The doctors came to the conclusion and told her mother that if Abigail received no treatment, it could result in her own death. And there were very few cases that had the same condition as Abigail, in which some of the women were pregnant. They gave Abigail intravenous steroids, which worked for a while but stopped working, and she felt the immense pain once more. She also got surgery to get a walnut-sized cyst removed, which had no effect, and also got rituximab infusions, which helped for a while and slowly started helping her feel less pain, but didn't help completely as she still felt really bad and really bad pains. The doctors gave her mother an ultimatum to save her daughter or save the baby. They said the risk was really high if Abigail would continue to be pregnant, and she would most likely not make it. Her mother decided to give them the green light to go ahead and give Abigail the surgical abortion, which did end up saving Abigail's life, and Abigail ended up recovering over months. Thank you for listening to my medical mystery case. And these are some of my citations.